Hello, 𝙃𝙚𝙧𝙚 Palsy here. Today, real quick, I just want to talk about finding a appropriate therapist, facial therapist. As a reminder, most PTs are not trained in facial therapy. This is not something we learn in school, and that needs postgraduate training in order for you to be qualified as a facial therapist and being able to help people with the most understanding of the condition, since the facial rehab is so different than any other type of rehab for any other part of the body. So I just wanted to come up with a few tips that you might be able to use if you have been either referred to a physical therapist for physical therapy, and what kind of question to ask. So you could do this either on the phone. Generally, the problem is you're gonna end up talking to a front desk person that will not know how to answer that question. You might, if that clinic allows it, being able to talk to the therapist before you schedule with them. So I would certainly ask about the experience that they have in treating facial paralysis, such as Bell's palsy, and some other key question to ask would be, do they treat Rounsey-Hunt syndrome, for example? If they don't know anything about Rounsey-Hunt syndrome, they are not facial therapists. Same thing as if what kind of scale and grading, how are you going to assess my face? What do you use? What does it consist of? And if they do not come up with the answer of using the Stanley-Brooke facial grading system, which is the golden standard for facial rehab, I would just steer clear from that therapy. And this is not an accusatory or pointing at my finger. It's just truly, if you want the best care, you need to work with somebody that has the experience and know how to help you retrain your face, and especially know what to do at what particular stage of facial paralysis. This is absolutely key, I think, in order to improve and to also especially not do the wrong things that are not appropriate for every single stage. Like if you do not have any movement, you should not be practicing active movement of the face. This is completely pointless if there is no nerve signal going to a muscle. So adding also, if they're going to use electrical stimulation, no, I would not go for that as well. That also means that they do not understand how the facial rehab works, and using facial stimulation will not make your nerve heal any faster or your muscle contract any faster or in an earlier timeline. So the other thing is you can ask them about what they know and how they would treat synkinesis. And again, if they do not know what synkinesis is, then I would just keep looking at working with somebody else. So those are like quick questions and things you can ask the therapist you're referred to. Again, there's a lot of people, most people are not referred to any kind of therapy. As you probably already know, the lack of knowledge on this topic for many aspects of the medical field is very limited, and you might just, besides your meds initially prescribed, you might not have any other sort of referral of any kind. So I've talked about some of those in a previous post, so it's beyond the scope of this one. But I hope this was helpful in knowing really what to ask and to kind of verify that the person you're going to work with actually know what they are dealing with. So anyway, I hope you have a great day, and I will catch you later. Bye-bye.